Today we are going to discuss Mr. Adamu, who hails from Nigeria. He sustained injury to his left thigh in 2017 and there was a fracture of femur. So he was operated in his own country and probably because of some issues the bones failed to unite, and he presented 3 weeks ago to us with the fracture of the femur with implant failure and non-union. So in non-union, what we need to do is take out the implant and put a bone graft and refix the bone. So that's what this patient underwent 2 weeks back. We took out the implant and there was great destruction of the bone inside, so he needed a lot of bone graft and the bone was refixed again. Now it's 2 weeks post-operative. He is doing well and we hope that this bone unites in time and he is fit to go back to his home country.
Actually, I remain Amite Pankaj from Nigeria. I came to Nigeria with my brother, Barrister Amite Pankaj, on which he was having an accident 2 years back, on which we have been retained in one of the hospitals in Nigeria with the problem of neuro and then a fracture of the femur. Actually, we have stayed for about good 8 months in the teaching hospital, Maiduguri. Later, we have been discharged. We carried the fracture problem down to one of the hospitals, on which they managed to operate, and actually on the process, things has become somehow. We later decide and realize the best alternative for us is to carry ourselves to a place or to a country where there is abundant and sufficient facilities as well as the equipment, on which by God's grace we found ourselves in Fortis Hospital, India, on which I can imagine and I can estimate the rate of happiness I found myself in, I and my brother. Actually, I have come to Fortis Hospital, Shalimar, Bagh, India. I meet a lot of people there, more especially with my case or that deals with the orthopedic department, under the control and under the leadership of Dr. Professor Amite Pankaj Aggarwal. Actually, I can never forget his effort. With all the tedious work he has seen on the fracture, he found it a bit very much easier with the courage given to me to make the work a bit successful. We have to thank God and thank Doctor for that effort. And then I cannot move also until I appreciate the effort of the international team of Fortis, Shalimar, India, for the effort rendered. In particular, Dr. Dutan, I can never forget that in my history. I can never forget her. And in particular with that, my friend Shandif, he also did a lot to me. To cut it all, the surgery has done successfully and we have now been discharged 2 weeks back with the courage doctors giving to us. But by God's grace, Barrister Amite Pankaj will walk and the wound will heal successfully. In addition, the deities of that particular hospital and more or less the nurses, the ward I stayed, they were very tight. In fact, they give a very much concern over me. In fact, I mingle and interact with most Indian peoples in the hospital. I found it very much easier. Some people are saying when you come to India, we'll be looking somehow, on which I do not see it anymore. Because that my friend Dr. Natun, I will keep on emphasizing her name, because she did a lot and she rendered a lot. So when I go to my country, by God's grace, I will serve as an avenue or as a field of advertisement to this particular hospital, because all I see to them is absolutely excellent. If to say I can reward them, or if to say I can support them out of 100, I should have given them 98%. with the rendered and the effort rendered to us during our stay. So my doctor, Professor Dr. Amite Pankaj Aggarwal, nice to you for the work done good. May God guide us, protect us. Long live doctor, long live my doctor Natun, long live my best friend Dieties and other nurses in the Fortis hospital here, and long live Fortis Shalimar, India. So
all
doctor,
the best.
Thank you, highly grateful. More grace, thank you, doctor. I was very, very much impressed. Thank you.
All the best. Best wishes. I'm Dr. Amite Pankaj Aggarwal. I'm Director of Orthopedics and Joint Replacement at Fortis Hospital, Shalimar, Bagh. We have been getting patients from all over the country, and primarily we get patients from Africa, and this particular patient that we are going to discuss today has come from Nigeria. And this was a difficult clinical situation where we had to do a lot of orthopedic interventions in the form of bone grafting, implant removal and refixation of the fracture. And this patient has done quite well, and hopefully he will resume his activities once he go back to his home country.